they are introducing this plan to give patients the choice. Go to whatever doctor you want to, whether they are included with Medicare or not, whether they are Medicare approved and within the Medicare system, you can go there, or if they're not, by all means, you can still go. However, there's a catch, right? There's always a catch to everything. Here's what the situation is. Situation is this. If a patient goes to a doctor who may not be covered by Medicare, here's what would happen. Basically, Medicare would pay up to the Medicare approved amount for whatever that doctor's visit was. And again, it could be a specialist, a primary care, whatever would be the Medicare approved amount for that specific visit, assuming that, taking into consideration if the doctor were to be on, accept Medicare in that situation. But then any additional expenditure or cost would then be pushed onto the patient, and the patient would have to pay that. So again, it sounds like a good thing. It'd be really nice for a lot of people to continue seeing their doctor, but the catch is there would possibly be some additional expenditures billed back to the patient, which would be honestly the Medicare beneficiary. And how much would that be? Well, it's a good question. It'd honestly be different for probably every single visit, whether you're seeing a primary care, whether you're going to a specialist, whatever it happens to be that you're having done, things like that. So it could actually add up to be a lot of extra money that patients are paying that Medicare would not be covering, because they're only going to pay up to the Medicare approved amount. And we all know how that goes. That could be relatively low, right? Generally, Medicare kind of doesn't pay all that much, which is why there's a lot of doctors out there that don't get involved with Medicare, because the compensation, the reimbursement is not all that great. We all know this. It's not a mystery, right? But anyway, so that additional cost or expenditure would be pushed onto the patient. So a quick example. I'm just going to mix up some random numbers here just to kind of give you an example. Let's just say in this example, somebody goes to a doctor who's not within the Medicare system. Okay, and they have some visit or whatever, and let's just say the bill comes out to $300. But for that visit, the Medicare approved amount would be, say, $100. Okay, I'm just making up numbers here just to illustrate the example. The Medicare approved amount is $100. The bill comes out to $300. Medicare pays $100 because that's what they've approved based on their algorithms and their adjudications, whatever it happens to be. And then the extra $200 of that bill goes on to the patient, and then we are on the hook for that. Well, for some people, that may work. It may be fine. I don't know. Maybe some people are totally fine with that, with the flexibility and the optionality to continue seeing their regular doctor they've been going to. Or some people might say, forget it, I'm not doing that. And to be fair, it's going to cost, quite a bit. It's going to be additional expenditures that a lot of people definitely wouldn't want to pay. But for some people that have been going to the same doctor for many, many years, and it's a trusted person, it's a trusted clinic, office, whatever it happens to be, may find, this might actually be worth it. So anyway, basically what they're trying to do is give additional patient choices that are on Medicare, because, like I said, these programs are great. All of these programs that are administered by the federal government, again, Medicare, Medicaid, Social Security, food stamps, things like this, they're really good, but there's also a lot of rules and restrictions around them, and that can be kind of annoying for a lot of people. So this would be really nice, and just something that, at the end of the day, if they're only going to pay up to the Medicare approved amount anyway, what's the difference? Let people go to whoever they want. But I would say this much. Also make it very, very clear that, hey, this doctor is not within the Medicare system. If you go and see this doctor, we will only pay up to the Medicare approved amount, and the rest will be the burden of the patient. I would make that very, very clear. Like, I would want that very clearly written out.